Hi, I'm Deidre Bentley, a GP at Jean Hales, and I'm here today to talk to you about health checks. So what are the important conditions that are affecting women's health today? There's heart disease, bowel cancer, breast cancer, lung cancer, and osteoporosis. And for all of these things, we have health checks and screening tests available. Things for breast checks, pap tests, bone health and heart health checkups, and also a general medical checkup. So keeping a check on your health is really important, and that's why we do these screenings and health check, because then they can prevent disease and illness. And for each individual person, there's different needs as to what tests might be required, and these depend on your individual risks, your age, your family history, and your own medical background. So a GP is the person who does those health checks. And why have them? Well, as we said, you check on your current health status. It tries to reduce the risk of further health problems. It gives you an opportunity to gain information and also for treatment if necessary. What does a checkup involve? Well, it involves taking a medical history, involves a blood pressure check, some blood tests, in particular a fasting blood glucose for diabetes and a cholesterol check, and other tests that may be necessary, including a bone density scan. It's important for one thing that you can do is to know your numbers, and these numbers are blood pressure, your cholesterol and your blood glucose. And then once you know those numbers and understand what they mean, to talk to your health professional about them and develop a plan as to what action you can take towards helping. The way to have a good appointment is, first of all, be prepared. Be prepared by making a list and prioritising that list so that you're not leaving that really burning question until you're just about to walk out the door. Bring with you a list of the medications that you're on at the moment and that you've recently been on, as well as a list of the conditions and illnesses and hospitalisations, including surgeries that you might have had in the past, as well as know your family history, because they'll ask you about that. And the important things in family history are things that might have happened at an early age in the family, things like cancers, strokes, heart disease, liver disease, blood clots. So they're some of the important conditions. Do your homework before you get to the appointment, and this homework can be things about reading up about things that you might think that you have, but always importantly go to the good websites such as Jean Hales for that information. And then before you leave your doctor's surgery, have a plan, a written plan either by your GP or one that you've written down yourself. When it comes to having those difficult conversations with your health professional about some of the things that might have been found in that checkup, it's important to have found the right health professional, and the good way to do that is from personal recommendations. Then ask the questions that you would like to ask. It's important that when you're having those difficult conversations to make sure that you've got some privacy, so leave any distractions such as toddlers at home for the day. So one of the difficult questions that comes up is, do I have cancer? How do I know I have cancer? And what can we do about it? Well, in answer to how do you know is you don't know and we don't know. That's why we go through the history taking, the examination, and then doing some tests that might lead us down the path to suspect that there might be a problem. And what do you do when you think you have cancer? Well, it's actually what you don't do that's more important. You don't go on to Dr Google, because you'll get some terrible information on there, and you don't put your head in the sand. What you do is make an appointment, have that conversation, and be persistent about getting the answers to the questions that you're worrying about. What else might you go to your GP for in this context? Well, it's something that happens out of the ordinary for you. That's when you need the symptom to go and have the checkup, and when you're worried about something else that's happening. So once you've had those health checks and screening tests, what now? Decide on what you can achieve to make those changes that you need to make. Small steps are achievable, and once you've made those steps and made those changes, reward yourself and celebrate for those achievements.